Yeah, I went down last February. One kid right there, so and then before that, yeah, everyone's been one of them has been twice. Yeah, it's just now I'm a gardener down there, so it's just the watering now. Improved it. I just did my picture plans and went to their staff and I was like, oh, are you? Our neighbors bought a big, neighbors down there bought a big farming project. But he's an engineer, so there's a lot of those guys. He's got this beautiful house here, so I go walkway out over the cliff above us. He's got his own big backhoe and huge construction and tons of workers. And he just bought a farm since cutting like apples and all this stuff. And he brought all the way back to the work.
Welcome to a special lighthearted version of Rounds. We're very happy that you come today. I know we have a lot of people online. And it's my great pleasure to introduce Dr. Deborah Money, who is joining us today as a special invited guest. And Dr. Money is the Executive Vice Dean of the Faculty of Medicine. Welcome.
So good morning, everyone, and thank you so much for asking me to come today. It's really my pleasure to welcome you to the Rounds this morning on behalf of the Dean, Mr. McCullougher, and myself. Really, the Faculty of Medicine is extraordinarily proud of the work that's done here at the School of Public Health, and really, you know, a School of Public Health is really a cornerstone of sort of forward-facing, public-facing Faculty of Medicine. I gather this is the second in a series of newly constructed rounds, these once-monthly rounds, and I understand that there's many online listeners, and in fact you're also streaming, so very forward-thinking. I really hope this new rounds format is going to showcase the depth and breadth of the faculty in SPPH and the wonderful work that you guys do for the public each and every day. So I applaud you for vamping up your rounds with this new format, and particularly looking forward to hearing how you use the Halloween theme to communicate the work of SPPH. So thank you very much, and it's a pleasure to be here.
I'm so excited for this. Hello, everyone. Jen Gardy, Assistant Professor in SPPH and your Faculty Coordinator for Rounds this year. It is my extreme pleasure to welcome you to our very, 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 very special Rounds event today. Never before have we had not one, not two, not three, but four presenters. Never before have we had people from SPPH and Pathology and Interdisciplinary Studies come together to give a round. And never before have we talked about something that isn't living humans, or isn't even dead humans, because we talk about dead humans too in our work, but we are today, for the first time, focusing on the undead sort of humans. We are going to be talking about the real public health science behind the zombie apocalypse, which we all know is coming at some point. Actually, out of curiosity, how many in the room, by show of hands, have at some point given even just the tiniest thought to what you would do if there was a zombie outbreak? Yeah, exactly. Most of the room. And those of us that didn't put up your hands were probably just shy about it. I know you've thought about it. And it's really because zombies are a huge, huge cultural phenomenon. You get shows like, you know, The Walking Dead, which is finally coming back in a few days, and we'll find out exactly who may get killed at the end of last season. It's exciting. But yeah, you've got movies, you've got television, you've got comic books. There's this tremendous sort of cultural phenomenon that surrounds these shuffling, moaning, groaning undead. And yes, it makes for great television, yes, it makes for great pop culture, but it also makes for really effective communication. It turns out that when people are excited by something like zombies, when everybody's familiar with it, it makes for a really effective teaching tool. CDC in Atlanta discovered this a few years ago when they did an emergency preparedness campaign that was all about what would you do if there were a zombie outbreak. You know, the idea of thinking about your water supply or how much canned food you have isn't really exciting when you think about it in terms of, you know, earthquake preparedness or getting ready for a natural disaster. But when you frame it as, oh my God, what would you do with a zombie apocalypse, it suddenly becomes that much more interesting. It goes viral. People are sharing this and really thinking about their plans. So we thought, let's leverage the fact that it's October, it's Halloween, everybody loves a good zombie, to use this as a teaching tool, show you if there were a zombie apocalypse, what would some of the real science behind how we as public health practitioners identify and manage that outbreak, what would that science look like? So we have 4 fantastic speakers. You're going to hear about everything from zombies in nature as they stand now. How would you diagnose a zombie infection, a totally new mystery illness? How would you apply basic epidemiological principles to managing your outbreak? And how math will save us all. So you all should have paid attention to math when you were in school, because it's what stands between us and certain death. Continuing medical education credits are of course available for this if you are a doc for your Royal College mock credits. At the end of the rounds we'll show you this survey link again, but you can go online after the talks and fill in the survey to get your CME credit. So without any further ado, I shall introduce the first of our 4 speakers. We are tickled to have Kaylee Byers with us today. She's a PhD student in the Interdisciplinary Studies program. Her work bridges public health and zoology. She works on the Vancouver Rat Project with Dave Patrick, that many of you have heard of. And she's also the hostess with the mostest at Vancouver's Nerd Night, which if you haven't checked out is a completely fantastic event. She gave a version of this talk that she's about to do at Nerd Night some time ago. And so Kaylee will be joining us to talk about the zombies among us. Kaylee, come on up.
Great, I love a good wander. Thanks for having me. This is, without a doubt, my favorite topic, and I think evidence of that is the fact that I've actually gone as a parasitized ant before Halloween. That is a fungus coming out of my head, and those are some impressive mandibles that are sewn to the front of my ant head costume. And what I love about this topic is it's essentially biological malware, and it is going on around us all the time. We don't necessarily think about it. And manipulation, essentially what this is a manipulation of the host. So the parasite manipulates the host in all to benefit itself. So by manipulating the host, it's able to go on and reproduce, and that's the whole idea of fitness and your ability to go on and survive and be reproductively fit. What's really interesting about it is it's actually evolved over 20 times independently, and that's pretty impressive to be able to manipulate a host in all these different genera. So we've got nematodes, we've got roundworms that manipulate hosts, we have flatworms that manipulate hosts, we have wasps, we have insects that manipulate their hosts, protozoans manipulate their hosts, fungi manipulate their hosts. That's pretty broad phylogenetically. So it's not like this is just reserved for one class of organisms. And as you can imagine, if we've had this evolve so many times independently, there are numerous mechanisms that occur in order for this to happen. We're not going to get into the nitty-gritty. That involves lots of statistics and fun graphs. Instead, we're just going to talk about some very cool examples and some of my favorites. This is one I actually didn't know about until quite recently, the zombie. So this is a small phorid fly here. It's actually smaller than a fruit fly. Apocephalus borealis, and it is found throughout North America. Previous to 2016, it has been found to infect bumblebees and yellow jackets, and what it does is it lays its eggs inside of the bee. Pretty classic. Those eggs hatch, it starts to eat the insides of the bee and change its behavior. It changes its behavior in such a way that the bee goes on a zombie-like death flight. So they leave their hive in the evening, which is something very uncharacteristic, and they go off to lurk around, and death ensues hours later. You will sometimes see these infected bees flying aimlessly around lights, or just sort of lollygagging around on the. Recently, 2016, the fly has also been found to infect honeybees, so that's, I mean, honeybees are already fighting all of the things in order to survive, so it's not great that now we have something else infecting them. But what's particularly gruesome about this fly, and awesome, is that when it's time for the larvae to emerge and pupate, they crawl out through the back of the neck of the bee in some kind of grotesque dance, and out they come and away they go to pupate. So that is one example of manipulation. This is one of my absolute favorites. I love this one. I call it the bodyguard. This is from a study in 2008. So we have this wasp, the parasitic wasp, Leptopantales, and it lays its eggs at a caterpillar. And those eggs don't do much of anything for the first little bit. They hatch, and as the larvae grow, once again, they start, eating the insides of the caterpillar. So the caterpillar gets slower and slower over time. And then, same story, these larvae need to come out, they need to pupate. Over 80 larvae can come out of this tiny little caterpillar. The caterpillar does not die. I would want to be dead. They crawl out of the caterpillar, they pupate on something like this, and the caterpillar takes up a stance. Now, a couple larvae stay behind in the caterpillar mid-movements. So if you are a small insect that comes along and gets near these pupae, the caterpillar actually thrashes them off until it's away, and then resumes its death-like nanny watch over the pupae. Right? You should look up the video, it's pretty great. So not all larvae pupate, some mind. This is another one that I just love. Wasps are super cool. In this instance, the wasp lays its egg on the back of the spider. So not even inside. So you might think, that's not so bad. I just saw 80 larvae erupt from a caterpillar. This spider has it easy. Well, the larva, of course, hatches from the egg, and it starts to feed on the spider. It has a little hole in the side of the spider. It starts to suck out that hemolymph over time, and the spider pretty much goes about its day-to-day, constructing its normal web. That's fine. But then, at some point, this larva wants to pupate. It's like the pupa is like the evil component of this whole thing. It wants to pupate, and it changes the spider's web-building behavior to look something like this. And the idea is that this web will actually bear weight. So the spider changes its behavior, it builds this very different web, and it goes and it sits in the middle of the web, and the larva consumes it, throws its carcass aside, I imagine dramatically, and then builds itself a cocoon from which it can later erupt as an adult. And finally, we can't end and talk about this without talking about cordyceps the fungus, and you can't talk about it without making a fun guy joke, and we can all collectively groan about it. Cordyceps is a genus of fungus. There's over 400 species, all of which are endoparasitic, and so once these fungi infect their host, and typically this is any kind of insect, you've got ants, crickets, spiders, etc., though spiders aren't insects, we all know that, very good, infects their host and changes their behavior. Generally, they might go off somewhere they wouldn't normally go. They'll leave the nest. We'll talk about that in a second, especially in the case of ants. But what this image is showing you is that those components of the fungus, the mycelium, take over the tissues of the host until the fruiting body can erupt from somewhere. I particularly like it when it erupts from the head, because I think that really drives the image home, from which the spores can erupt and go on to infect other insects. Now, a really cool study in 2009 found that in ants, one of these species of cordyceps will cause the ant to go up when it's infected and crawl to the underside of the leaf and grab onto that leaf vein with its mouth parts. And so imagine it's upside down, the fruiting body comes out the back of the head, and then spores rain down everywhere on the little ants that are underneath and currently uninfected. What was really cool about this study is they found that the cordyceps actually made the ant go to a very specific spot on the underside of the leaf. It had to have the right temperature, it had to have the right humidity. These researchers came along and they moved infected ants. They put them up high, they put them in drier areas, and they found in all these other spots, the fungus did not do as well, and it wasn't able to have the same kind of impact with its reproductive spores. And so not only do you have a fungus that's taking over the tissues of the host and making it, crawl up on the underside of the leaf, that leaf choice is very, very particular to further the biology and reproductive success of the fungus. And so then, my question to you, and where we're going with this is, we have all these examples in nature, who's to say we're not next?
Awesome and disgusting. I love a good parasitism talk right after breakfast. So those were some fantastic examples of zombies in nature when you've got these kind of the moaning insects spraying spores everywhere. But zombie insects, zombie parasites, zombie fungi don't really make exciting Hollywood blockbusters. It's usually a virus when we see World War Z or Z if you're American. It's a virus, and it's usually some version of a modified rabies. What happened if a zombie outbreak appeared? We had no idea what was causing this new strange disease. Who would we call? The answer is not Ghostbusters. The answer is Mel Krajden. Mel is a professor in pathology and lab medicine. He's also the director of BCCDC's BC Public Health Laboratory. And Mel is going to talk to us about how you would diagnose, the zombie apocalypse. Yay!
Thank you, Jen. So maybe Donald Trump is about the spore light. Maybe I was behaving the way he is. So I have some disclosures, but I donate everything, and everything goes back to the institution. So I want to talk about the zombie agent, highlight some of the changes in diagnostic tools that have occurred really over the last decade, and introduce some differences between active infections and resolved infections. So the usual zombie story. So these are actually real cases, but I'll go back to this March 13th case. So in March 13th, 2003, there were some outbreaks of influenza H5N1, which was associated with avian influenza. And then there was this patient that showed up at Vancouver General with 55-year-old, and they had ARDS, which is acute respiratory disease syndrome, where the lungs basically white out and they had difficulty breathing. They had stayed out in Hong Kong, and the wife had had a flu-like illness and accompanied the husband, and they went right from the airplane to the emergency room at VGH. And then there were some other cases, that history of travel to Hong Kong, and then a healthcare worker. And what was important was on that evening we had a call from Alison McGeer in Toronto, who had a son who'd come from Hong Kong, and then he had died, and grandmother was very sick. This was a Thursday night. By Saturday we had used the normal tests that we could use, and we actually couldn't find an agent, and we'd sent materials to the National Lab in Microbiology. So one of the things we had was the serum from the wife who had recovered her illness, and we had the endotracheal aspirate, the fluids from the lungs, in the husband. And Martin Petrick, who was working with us at the time, did a really old technique called immune electron microscopy, where you take the serum from the wife, you mix it with the endotracheal aspirate, and then if the antibody is present, it'll clump the virus. And in this case, what we saw were these tiny little particles, and they were really, really tiny. What happened was that we saw this, and then from the case, we then took samples from the Toronto cases and spun the virus and showed the same particles. And we then spoke to the people in Toronto and got serum from the people in Toronto and their endotracheal aspirates. And we took this Toronto, used the same aspirate from the patient here, and showed the same clumping. And this took a week. And within a week, we knew the agent that was found in Vancouver was similar to the agent in Toronto. So the way the virus was actually detected was they were able to grow it in a certain cell line in the National Microlab, and that's the cytopathic effect that was seen. So in 2003, the old way of pulling rabbits out of the hat, a slow library prep, cloning the materials, you had to grow the virus. It took a week, and it was done by the Genome Sciences Center in really record time. It was really quite impressive. The sequencing itself took 12 hours, and a computer did the alignments to show that this was indeed a new agent in 5 minutes. And it took from the beginning of the recognition of the cases in Vancouver till the publication of the sequence, I think at 2 or 4 o'clock in the morning on a Saturday night in April, about 1 month. So when you think back, with HIV, it took about to discover the agent of HIV. For SARS, it took about a month. And it turned out that what we saw in the electron microscope was actually not the total virus. We were seeing these peptimers, which are these tinier pieces. Today, it's a different world. And I'm not going to go through the details, but essentially, you have the capacity to do whole genome sequencing. There's vagaries to how you do this, but in the end, you could go from a new agent to discovering what it is within about 3 to 4 days. And that's a totally, totally different world. So there's also newer techniques that are USB kind size pieces that can do sequencing in the heart of Africa and has been used for tracking Ebola in real time and doing phylogenomics to compare the things. So an important question is genomics or omics, the holy grail. And I think one of the things that's important to realize is that the nature of the agent, the temporality of the agent, the host, the environment, are all important. And then for each agent, you can have viremia, bacteremia, fungemia, and those can be transient or prolonged. And so a lot of the way we think, is you get an agent, you may or may not have symptoms, it may create a zombie in you, you can have an acute infection, you can clear the infection, it can be latent, like tuberculosis, or you can have a chronic infection like HIV or Hep C. And omics or genomics is very good for telling whether you're acutely infected or you have some latent infections that you really look hard to identify. But when you think about trying to understand the infectiousness, you need to be able to look at both humoral immunity and cell-mediated immunity. And examples would be for tuberculosis, you can detect TB acutely this way, and Jen has done wonderful stuff on the phylogenetics of TB. But if you want to look for latent infection, you're looking at cell-mediated markers of infection. So that's same is true for pathogens like C. transient viremia, may affect the child. You clear the infection, but to determine whether you're latent risk, you need to do some reasons because they cross-react between the other likely viruses. And it's this whole notion of being able to deliver comprehensive lab diagnostics, which is who's infected, how long are they spreading their infection, how do they resolve their infection, and really understanding what the immune response needs to be to protect you. And those are the kinds of things that help you decide about vaccines and things like that. And this just actually represents a serological test that was rapidly developed to assess SARS in those patients, and you were able to show that in fact they were infected, they did develop an immune response, and this was just the process that was done. And I think that's enough.
So The sequencing stuff that Mel showed off, that the genomics technologies that can do this in days, it's now gotten down to the point where it's in hours. One of my favorite failed zombie apocalypses of recent history was a couple of years ago. There was a discovery of a new, it was basically a viral hemorrhagic fever, and it's now called the Congo virus. It's found in Lower Congo. And when researchers used genomics to discover the cause of this weird, unknown viral hemorrhagic fever in a series of hosts in this one village, everybody was really excited because it was a virus that looked like rabies in terms of its genetic relatedness to other viruses, but it acted like Ebola. So the headlines were rabies Ebola set to take over the world, and it made the news for a couple of weeks, but then it turned out there were only 3 cases long in the past, so we never got our promised zombie apocalypse. But we did get a rabies Ebola virus, which was fairly cool, and it was all deduced by, it's super interesting, all deduced by genomics in the space of a few hours. So next, Mel's talked about what would happen if we were confronted with a new agent, how would we understand what it was, what is making people sick. David Patrick from SPPH is going to talk about the epidemiological aspects of what we would do when confronted with a zombie outbreak. So Mel and his team would be working in the lab to figure out what is making people sick, how can we develop a treatment or a cure. David and his team are going to be out there in the field, out there amongst the shuffling hordes of undead, figuring out how exactly do you control these things. So David, come on out.
Well, thanks, Jen. I don't know if anybody noticed, but earlier on when Jen was introducing, if you're SNL fans, she had the casual lean. Anyway, I'd like to just point out that Lily James will not be here to save us. It's going to be up to us. And so instead of getting fearful, think about what you know in public health and what's the role of public health investigation with an epidemic or an outbreak. Your job is to understand the cause of an illness, is to investigate the outbreak in order to be able to pull it to an end. So you need to know how the agent's transmitted, you need to know the efficiency of transmission, you need to know how to interrupt it, and yes, we'll be working hand in glove with laboratories in terms of diagnostics and treatments that can help. So let's dissect that a bit. The general approach in terms of public health readiness is sort of a readiness to go, a surveillance and rapid detection culture that's ready to pick things up. And you might think this is extraordinarily high tech. These got started, it was astute clinicians who recognized that something was wrong. When SARS got started, it was astute clinicians. Now, if anybody actually acts like a zombie, even like emergency guys who I think are not awake all the time, they're going to notice that something's unusual, and they're probably going to raise the alarm. And raising the alarm early is important. This is the Hong Kong SARS epidemic curve, and if you had the opportunity to intervene after the first couple of cases and shut it down, you would have prevented a significant outbreak there. So what does this take? Well, actually, a lot of this has been with us since the mid-19th century. The generic low-tech responses are the clinical description. To that, we add our public health outbreak investigation, where we learn about the attributes of the people, the places, the timing of things, but particularly we're interested in how is the disease transmitted from person to person, what's the incubation period, and we marry that later with the high-tech responses. So if you ever have taken my course or anything else, you might have been introduced to this epidemiological triad, host, agent, and environment, where you think about containing an infectious disease, you have to think about all of them, because you may be able to act at all of them or the connections between them. So we're modifying that today with the host agent environment zombie model, where the zombie sort of takes a central position because it interacts with everything else. And I'd like to say this is original, but I really basically stole it from Eleni Galanis, who would give me this model if she's dealing with a zoonosis along the way. Now, the thing here that you should think about is that we really should be thinking about all hazards. Jen was hinting at this earlier on. So if you're in government or fire or the military or health authorities, you recognize this structure, which is whenever you have a crisis, you've got to have a way to organize it. And this incident command structure is one that could apply to anything. You need somebody in charge. It might be our Chief Medical Health Officer for BC, and at the bottom you've got people who are going to do the operational stuff. But you can't forget you need to pay for it, you need to have planners, you need to have people helping with logistics, You need to communicate with the public, liaise with other organizations, and of course in the zombie thing, this thing's going to be kind of important, I think. Safety and security and risk management. It's going to be bigger than we ever had experience with anything else. But what about you? Jen sort of ripped this off at the beginning, but the truth is that you all had shakedown this week, and then you'd be told to organize a care kit, including the flashlight, the batteries, the radio, the canned food, and that's not all. You want to make sure you have a meeting place where you go with your family, you think about an evacuation route, and whether you're thinking about a quake, a tsunami, or a zombie apocalypse, this kind of all hazards preparedness is something that all of us should be ready to do. So let's go to the host. Let's go to that vertex of the epidemiological triad and think about what we can do if we're the host. Well, the all hazard preparedness is there. Social distancing is going to play a role. To the right there, you've got a little bit of a social network, and these highly connected people are probably in trouble if something's moving around a lot. You're better off at the edges of a social network where you're less likely to have a lot of contact with people, and so the modeling done so far would suggest the Rocky Mountains is a good place to be. But barrier methods, once we learn the method of transmission, so let's assume that it is by bite. You don't go out there and take down a wasp nest at your place without covering yourself up in biker leathers or whatever you've got that's similar. Human teeth don't bite through leather very easily, so you could begin to think about barrier methods to protect individual hosts. Down the line, if Mel gets off the ground to characterize an agent quickly, we might be moving towards a vaccine, but it's not going to be available in the first few months. Last pandemic we had, it was available, 8 or 9 months later, almost too late to make a big impact. You want to quarantine exposed people, so if you've been bitten and might be in an incubation period, you don't really want to hurt your family, so you want public health to have a way of sort of putting you aside, keeping an eye on things, supporting you, offering you treatment. And I don't actually believe in the thermodynamics of waking the dead. We have to think about this as scientists, but if you want to take the superstitious thing, then maybe you need to cremate the dead so that you don't have a reservoir of future zombies. So when it comes down to the agent itself, we're going to learn from Mel, for example, this is an enveloped virus. Well, then certain types of disinfection are going to work, and if you want to reduce environmental decontamination. If it's related to something else, what if it's a retrovirus? We've got a whole bevy of antiretroviral drugs. What if we could have curative antiviral treatment? What if the sera that Mel used in diagnosis has a therapeutic value? If people convalesce, this was certainly looked at very closely with Ebola, and that's an intervention that could be available pretty quickly. And then you want to break that agent to host side of the triangle if you can, and that's infection control. And it could be the sort of individual measures I was talking about with the leather, but infection control involves more than that. It involves engineering your buildings, your hospitals, your communities. It involves institutional policies that make things work, and it involves community protection. So I was thinking about this, and these raccoons are up there for a reason. They are voluntarily taking a vaccine. This is a raccoon vaccine base. You've got the vaccine, you wonder, how am I going to get this to the raccoons? Well, you drop the bait, they eat it, they're vaccinated for rabies. So I was thinking, well, if we had a vaccine for zombies and stuff that might be either curative or preventive for people who are wandering around there, what could we do? Well, we may be able to do the same kind of thing in terms of bait stations along the way. So I just want, you gotta keep yourself thinking, learning from what we already do. Now the environment, according to the movies, you want to keep quiet because that seems to attract the zombies. You want to control your entrances and exits. You want to remove stuff that attracts an animal or a zombie that may move things. So in the same way you want to control rat-borne diseases, you don't want stray body parts and other sources of food just lying around that are going to attract this potential animal vector. And of course, physical barriers are going to be relatively important. You may need ditches, trenches, fences, that sort of thing. There's going to be a role for civil defense. And this imaginative person on Pinterest posted the idea that, if you have treadmills on every side of your house and the zombies are coming at you, well, you've actually solved the problem, and it's going to keep rolling. Now in the community, when you talk about any infectious disease, you talk about restrictions on assembly, and this has been entertained with serious respiratory pandemics along the way. That could include then school closures, and this is a means of achieving social distancing as a society. You can talk about restrictions on travel if something's bad enough to prevent things from going back and forth, so people were advised not to hang out in all parts of West Africa. But it's important to make a good risk assessment because you can have collateral damage. If you jump on something too early, as the WHO did with Toronto and SARS, you can cause a lot of damage that really does absolutely nothing to break up an outbreak. However, if this was sort of the scene in our schools, I think there'd probably be pressure for school closure. Now let's talk about the zombie, and this is at the heart of it, the zombie. Why are we saying the zombie? I mean, we don't do that with anything else, so we're living in fear and superstition by actually, going this way. So if you have a person that's infected with something, and you don't want them to affect others, then you want an isolation procedure to deal with it. And I don't want to run around with a shotgun blowing people's brains out to achieve that. I mean, who says that you can't sedate a zombie? They're going to be working on more or less the same physiology we are, so it may be possible to achieve isolation with sedation and a bit of security and that kind of thing along the way. We could have non-curative treatment that reduces infectiousness. Look at what that's done for the HIV epidemic, folks. So it may be possible that if we've got somebody with a virus like this who we can't cure, that we can actually change the dynamic of an epidemic. And then I was thinking early on, maybe I need ethical consultation. Is a zombie actually human? And of course they are. You know, you don't have, the laws of thermodynamics aren't going to sort of make it such that you can just wander around indefinitely with no energy source, and you can't bring back, critters with no brains and stuff like that. So we really are talking about humans. And so let's learn from the social science of public health. Is zombie stigma going to get in the way of solving this epidemic? If you don't want anything to do with the zombies, you're going to have a big problem. This should be a person with a zombie agent or a zombie virus. And let's not have to relearn that lesson. And so these are the ethicists I talked to about now, public health roles in an epidemic, if you're talking about the public health service that's out there, can include contact tracing and case finding. Remember, contact tracing is locating potentially exposed people, putting them in quarantine, or giving them preventive treatment. On the other hand, case finding is locating infected people and doing that isolation and treatment. Now, in this kind of apocalypse, this could be dangerous work, so who can we send is the real question I ask. The first thought I had was street nurses. They're really good at getting out there and doing things, and I really, admire the work that they've done in the face of all kinds of difficult things. Failing that, medical students. They're a group that we often consider there. But no, in the real world, what happened with Ebola in West Africa was that a bunch of volunteer healthcare providers walked into harm's way and decided that they were going to make a difference caring for sick people who could potentially put their lives at risk. And so that's why the Ebola fighters were the Time Magazine Person of the Year in 2014. And Mike Records here, he's one of them. So there you go, Mike, Person of the Year. You're first in the zombie apocalypse. So is there an end game? Known criteria for infectious disease eradication are these. That the humans are the only host, so if that proves to be the case, then that works to our favor. That you need an efficient and practical intervention to stop transmission. Well, we need to learn about that. That's why we learn about the agent, we do the outbreak investigation. That's the big question mark. Is it easily recognized or diagnosed? Well, yeah, it's a lot easier to recognize a zombie than almost anything else. So that's a pretty good clinical diagnosis, just like sort of smallpox was. And political will, which would probably be there if this thing ever materialized. So you can imagine a world where zombie virus is dead or undead or however you want to call it in the end. I was going to say a word about modeling, but Babak's going to say a lot about it, so I'm going to skip right down.
So as I mentioned off the outset, the thing that will save us all is math, so I hope you all paid attention in calculus. Babak Pourbohloul, our fantastic math modeler here at SPPH, is going to give us a walkthrough. We're going to switch slides here, because he's got fabulously large slides. Another window. Click on this thing. Babak's going to walk us through how math will save us all from the impending zombie apocalypse. Thanks, Babak.
Thank you, Janet. Good morning, everyone. So yeah, I found this 2 items on the web. It looks interesting. I really don't know if it's mass modeling that is promoting zombies or is the other way around, but it's good to have it there. But besides the commercial aspect of zombie modeling, which slide? The space bar? Or?
Oh, down there.
Oh, yeah. On a more serious note, of course, U.S. Department of Defense actually developed a full-blown, basically guidelines for zombie modeling, zombie preparedness. And it's interesting to note that there are different kinds of zombies. So basically, you have pathogenic zombies, you have radiation zombies, and what I found really interesting. Zombies. I think the most important one is the chicken zombies, because it says, although it sounds ridiculous, this is actually the only proven class of zombies that actually exists. So, and of course, for each category there, you can develop a full-blown international model separately. And what I'm focusing on is the pathogenic zombies that I think we're all discussing today. And in fact, the person who really promoted this business was Robert Smith, my colleague at the University of Ottawa. And yes, the question mark in his name is not a typo, it's actually a part of his name. And so this is a book that was published by the University of Ottawa Press. Interestingly, the whole thing really is based on this original paper, which is a kind of serious attempt of addressing zombie spread, considering a transmission dynamic mathematical model. And most of the, a couple of slides that I prepared to really show you the structure of the model comes from this paper. And in a sense, the way that they used it, they looked at the spread of zombies as an epidemic process. And in this particular situation, they really look at it as a continuous flow. So let's assume that the water is flowing into these small basins from one point to the other. You could also look at or consider population epidemiologically in the same way, in that in the first place you have the susceptible population, and then it flows, some people become infected, and a fraction of the population that is infected, then they don't become recovered. Similarly, we can look at this, buckets or the barrels of water. So the first one is susceptible, and then you connect them by these pipes. And of course, if you put a valve on the pipes, then you can control the flow, which is really the transmission dynamic parameters, the rate of initial spread, or this is the recovery rate. And so you fill up these buckets one after the other as a kind of continuous dynamic flow. And of course, the idea that they use is the homogeneous mixing, because the most important thing is that how people connect with one another, how they contact. And in this particular case, it's a simple toy model. They assume that, of course, it's a kind of random mixing, and it's like the cookie dough. You just mix them to come up with a kind of uniform, to arrive at a uniform state. And in a sense, you still take into consideration of the role of individuals, but what is really important for you is the flow. And the flow of population that goes from the susceptible to the infected group. And so using that approach, then they model zombie transmission dynamics by using this flow chart. So you have the S class, which is the susceptible class. So in day one, let's say 2.4 million chlorides are in the S class, and then they become zombies, some of them, because they become infected, and of course they are removed later. And everything that you heard is basically encapsulated in this model. So in a sense, susceptibles can become deceased through natural causes, or the removed class, individuals who have died either through attack or natural causes, they go to the removed class. And then you have humans in the removed class who have become zombies. And then you have new zombies can come from two sources, the resurrected ones and the susceptibles who have lost an encounter to a zombie. And then you have zombies move to removed class upon being defeated. I think zombies do not attack each other, so that's a good thing to know. So one of the suggestions was to actually wear some kind of makeup so that they show, you look like zombies and then they will attack you. And in the end, susceptibles can become zombies through transmission and through an encounter with another zombie. So this is really a kind of full-blown transmission dynamic model, and behind it are a set of differential equations that you solve in order to see the number of cases that are produced as a function of time. And of course, there are variants. The reason that I said models as plural is because there are different versions of the model. And another one is when you add a latent box in the middle for the incubation period, because there is a period of time, approximately 24 hours after the human susceptible gets bitten, to succumb to become a zombie. And of course, you can then model intervention strategies by adding a quarantine box. And in fact, infected cases would move towards the quarantine box, and in the end, based on these scenarios that are explained there, they would recover. So in terms of intervention, using that work, there was another group that took it a bit further, and they also looked at the impact of different intervention strategies. And basically what we see here is that the solid green curve is the number of zombies over time. It's basically the incidence of zombies. And it really shows the impact of early intervention versus late intervention. And in that sense, you can come with different policy design. And in fact, what they really call here is a kind of military intervention, because they want to implement the quarantine. So from zombie world to real world, this is the first graph that we received from the Mexican authorities back in 2009 for the pandemic influenza. So the first, the PH1N1 pandemic influenza in the 21st century. And of course, what was important for us was to determine at the initial rate of spread of disease. That's key. When you don't have any vaccines, or when you don't even know the impact or the effectiveness of antivirals for an emerging pathogen, the only thing that you could do is to estimate the initial rate and come up with some sort of social distancing and other mechanisms. And in fact, we were fortunate enough to work in this area for a while, to develop the mathematical techniques to rapidly analyze these systems in real time. And in fact, we were among the first groups worldwide to assist the government of Mexico to come up with the initial reproduction number. We all know it as R0. So in fact, that's a key factor in controlling disease. It could be zombies, it could be any emerging pathogen. And this is really a point I want to highlight here, is the importance of this global nature of collaboration when it comes to pandemics. So if we really want to be effective locally or provincially, we don't need to adjust our mindsets provincially. We really do need to work globally. And as a result of this global collaboration, what happens is that we can benefit in the end locally. And how do we do that? When we know the rate of spread, we can develop models to look at the way that individuals move, the mobility pattern within the entire Canadian population. And here what I'm showing you is basically the air flights, the air travel network, and the local commute movement between all 34 million Canadians, all provinces across Canada. And you could just imagine that because we assign an incubation period to zombies, so there could be the first case in Toronto, and then they get into a flight and they come to Vancouver. So the first importation, and just imagine that in the middle of flight, they become zombies. So they are sitting next to you. So it could be as horrifying as sitting next to Donald Trump in first class that we all noted last week. So, but anyway, you could go even further and look at the commute pattern in each and every urban area in Canada. And this is exactly what they showed here. And in fact, you can do so for the entire Canadian population. So using this amount of information, now we are ready to test different intervention scenarios to combat effectively against a pandemic threat. And so what I'm showing you here, this one graph summarizes 6 million simulations that was done on a Westfield supercomputer at UBC. And what it tells us is the relationship between the timing of a vaccination program and the effectiveness on the epidemic curve. So the dark blue, the very highest one, is the no intervention scenario. And depending on the assumptions that we made about the timing, those colored dots show how effective the intervention strategy would be. And as David alluded to, in this particular case, the late introduction of vaccines was really not that much effective. Or in the same way, we could look at the antiviral stockpiling and the impact of distribution of antivirals in order to slow down the epidemic. And of course, it's a part of the video clip. I'm just showing different screenshots. But generally, we are now well equipped with different a suite of mathematical models that is relying on high resolution demographic data and could assist us and the policymakers to come up with the best intervention strategy in combating an emerging infection and also zombies. So we are ready for zombies.
Thanks, Yay! That was super interesting, and if you haven't read that Robert Smith question mark paper, it's super, super good. If you want the TLDR version, the only strategy, the only intervention that works is impulsive eradication, where you basically throw everything you have at the zombies repeatedly. You bring down their population numbers with each successive strike. There might be some collateral damage, but eventually you will eradicate them. If you develop a vaccine, interestingly, the models show that you just reach a stable equilibrium between humans and zombies, or persons with the zombie agent, as Dave pointed out. So fascinating paper. Excellent series of talks, everybody. Thank you so much. We do have time for questions. If you don't want to put your hand up in case you get bitten off by a person with the zombie agent, you can tweet your questions using the hashtag SPPH rounds. I will keep track of them here and answer any that come in online. But let's go to the room first. Hands or other body parts up if anybody would like to ask a question, and feel free to direct it to a specific speaker, or I can flip it to one of them. The floor is yours, folks. I personally would say that the treadmill model of defense is a poor one, because the zombies are going to be flung off the treadmill and then just kind of build up in a pile. At some point, some of the zombies are going to fall off the pile and get caught in the treadmill and ruin the mechanism, and then you're not going to have an effective defense thing anymore. So didn't really think that one further than, you know, the first 2 hours of the apocalypse. Other questions or speculation or ideas? I like on Twitter the non-curative treatment to reduce infectiousness: wash the zombies and provide brain-flavored mouthwash. Excellent. Questions in the room whilst I refresh Twitter? Surely somebody has a question about the zombie apocalypse. Excellent.
Well, I was wondering about the parasites that are able to manipulate their host. So are there any mechanisms known, like on the molecular or optical basis?
Yeah, great question. Come on up to the mic, and then the folks. So the question was, for those of you that are listening online, what are some of the molecular mechanisms, things underlying these parasitism and zombies in nature?
So given it's so terrifying, you would think we would know more about it, and we really don't. It depends on your organism, of course. So in the case of the spider, the change in web-building behavior is a secretion of a chemical into the spider that changes its behavior. How exactly that chemical acts, we still don't know, and I can't remember the name of the chemical off the top of my head. There are some instances where, similarly, it could be, we're unsure whether or not it's either secretion of a chemical that has an effect on the brain, or in some cases it's actually just the presence of the parasite pushing against some component of the brain of the host or some other area in the body that causes the change in behavior. So I know a few groups are working on it, but still pretty unknown.
And,
you should go research it.
yeah, it's very interesting. And do you know if these chemicals are very host specific, or can they also be used? Can they also change the behavior of other species, for example?
Yeah, good question. So are these chemicals and things species specific, or are they broader? Many of these host-parasite interactions are species specific, but for example, with the phorid fly, it infects at least 3 different species of bee or the yellow jacket. So I imagine that it's acting in a similar way. That's the same species of fly for all those different organisms. But many of these interactions are species specific, so whether or not they could act the same way with different species is unclear, because you don't find them in other species.
Other questions?
I have a question about the last remark, Dan, and maybe Babak. people have understood the modeling paper by Robert Smith, question mark, and will be able to explain this. But David went through some of the criteria that make it favorable to eradicate an organism. And one of those that wasn't actually listed is a highly effective vaccine. And so if Robert Smith's model resulted in the conclusion that there would be a stable equilibrium between humans and zombies, what assumptions did they make about the vaccine? Because the other zombie eradication criteria were highly favorable in terms of presumably they don't have a latent state or a non-human reservoir, and they're highly visible.
Absolutely. So David and Babak will come up to address the question, which for those of you online was, given what we talked about just a moment ago in Robert Smith question marks paper, I don't even know how you pronounce the question mark. Is it silent? I have no idea. But in his paper, I mentioned that if you introduced a vaccine, it would result in a stable equilibrium. So Monica was wondering, how effective is the vaccine that they modeled? What assumptions did they make in that, given what David said about zombies really nicely meeting the criteria for eradication? So David and Babak will handle this.
I'm going to let Babak talk to the paper, but I want to remind you about this, and that is, if you're a zombie virus, how do you define reproductive success? And so those of you who know what R0 is, it's the average number of secondary infections from an existing case. And any number greater than 1 for that, for a microorganism, means an epidemic is going to happen. But the bigger that number, the more challenging it is. And to Monica's point, the greater vaccine coverage you need in order to achieve herd immunity. There's a direct relationship between the height of R0 and the amount of vaccine coverage. So that becomes kind of important when it comes down to looking at that. And then if you're going to actually derive R0 from the sort of models and data that Babak was looking at, you notice there was a rate of flow from the susceptible to the infected, and there was a rate of flow from the infected to the recovered. And you put those two parameters, one over the other, you get R0. And so the problem is, if you don't have a recovery rate from zombieism, you're going to have a very high R0. And so the natural history is going to determine it all. And I don't know exactly what assumptions were in the paper, Monica, but Babak can speak to those.
Yeah, thank you, Monica, for the excellent question. So what happens with I should have highlighted that the Robert Smith question marks approach is a simple compartmental model. And in fact, most of the scenarios that they tested, they concluded that there would be a complete takeover by zombies. So basically 100% of the population would be infected, which is not quite true, especially if you take into account modifications to the model. So one of the graphs that I showed in the end actually takes into account a technique that we call Markov chain Monte Carlo, or MCMC. And if you really apply these stochastic features, then there is a likelihood of eradicating, but it depends on the timing of intervention. And the timing of intervention, which is a good timing or bad timing, as David alluded to, depends on how infectious or how rapidly zombies would spread and would take over the population, similar to R0. So it depends on the assumptions, because we haven't had zombies yet. You cannot estimate R0 for that. The other question, if you recall in one of the graphs I showed a newborn baby, it was basically indicative of the birth rate and death rate. So there is a discussion as to how long it would take for this takeover. Is it over generations that we need to take into account the demographic variability, or no, is it short? So there are certain assumptions that should be taken into account, but there are effective vaccination programs that could halt zombie spread, depending on the model.
So I just want to say that if you used human papillomavirus vaccine as a perfect example, if you don't have the uptake, you're not going to prevent the infections. And David alluded to this, the challenge that we face in our society in being able to get people comfortable that this is a better strategy than getting human papillomavirus, zombie virus. And the same is true for hepatitis B and things like that. So part of it is developing the social interactions that basically create a comfort in the population that this is the right way forward for your safety.
Excellent, thanks Mel. It is 10 o'clock now, so with that we shall wrap up. There's coffee and Halloween candy outside if you've got any more zombie related questions for our presenters. We're happy to take them.